Well, today on the show, we're at Ocean Springs Hospital, part of the Singing River Health System, and we're in the Cath Lab. And we're talking to Dr. Zayed, who is the medical director in the Cath Lab. How are you, sir?
How are you doing?
It's good to see you. It's been a while. We wanted to come and find out some things about the new things that you're doing here, plus the fact that over the past few years, Ocean Springs Medical Center has been recognized for their great work in this field.
Yes. And as a matter of fact, we have been awarded the Blue Distinction Achievement Award from Blue Cross Blue Shield. We're one of the hospitals in the network that is able to deliver cost-effective, safe, and efficient care to patients. And we have improved outcomes and reduced risk of complications. This is obviously has been going on for several years, and I think it reflects well on how the hospital is perceived in the community. We are also one of few hospitals that have been given the Gold and Silver Achievement Award with regards to the management of patients with acute myocardial infarctions.
Oh, wow, that's wonderful. Now, you had told me before we actually started taping that when it comes to response, things like that, national average is like 80.
National average, yeah, this is something now that we follow that is called first medical contact to device time. Before it used to be called door to balloon time. Door to balloon time would basically start the clock from the time the patient hits the ER to the time the arteries open. Now they have actually become more aggressive with regards to the time, and they want us to start measuring time from the time the patient calls 911 to the time the artery is open. The national average is 80, the acceptable time is 90, and we are at about 65.
That's awesome.
Which reflects, basically, it indicates the quality of care that's being delivered not only by the cardiologist, but by the Cath Lab team, Cath Lab personnel, emergency room physicians, all working together in order to achieve these.
And not to mention the emergency response team that goes to get to their home. You know, and you said too that a lot of people think, you know, I'm feeling bad, I could be having a heart attack or whatever, I'll drive myself to the hospital or get a family member to drive me. That's a bad idea.
That is a very bad idea. As a matter of fact, don't even try to waste time calling your primary doctor or your cardiologist on the phone, because this is all valuable time that is wasted. If you think you're having a heart attack, then the best thing to do is call 911 and wait for the ambulance at home. Driving or having somebody drive you could be disastrous, because you could have a cardiac arrest in the setting of a heart attack. Driving or having somebody drive you, nobody can help you there.
Because they might not be able to find you.
Right, and at least when you're staying at home, there's always a reference point for the ambulance to get to you.
Okay, so once they get here to the hospital, take us through that. I mean, you've got some new things in place here now that are really speeding things up again.
We have the Pulsera system. It helps streamline care and helps shorten the duration of time from the time the patient is in the field, met by the paramedics, to the time they get to the Cath Lab. The Pulsera allows us to all get electrocardiograms sent to us on our phones at the same time. That way we save time with regards to the time an EKG is obtained in the ER and the time when the ER physician looks at the films and then calls the cardiologist. So we're all activated at the same time, and hopefully that will save some valuable minutes. Another really thing that I would like to mention for the community is that the shortest time is the time spent in the Cath Lab. Meaning that out of the 90 minutes that are allotted, most of the arteries we can open within 10 to 15 minutes from the patient comes to the cath table. So we can save a lot of time by actually speeding up delivery and by improving recognition of symptoms of heart disease and having patients call early and not waste time. Most of the time is wasted outside the hospital, but once they get to us here, it takes us a very short time to achieve patency of the blood vessel, opening it up and restoring flow to the affected heart muscle.
So that 65 minutes that you're talking about, I would assume that a majority of that is going to be spent outside the hospital, as you said.
Absolutely.
Getting to the patient, getting them, I don't know, secure, just whatever in the ambulance, and then getting them here to the hospital. And then once you get here, it's just bam, bam, bam,
it's
bam.
Fast. It's fast. This is the least amount of time for
and
the patient.
And that's why
is
you've
going to
run
be
so many awards here at Ocean Springs.
I think it's really all of us are doing a good job
by
working together.
It really
teamwork. Different cardiology groups who work together in the setting of acute care, acute heart attacks, who cover each other, and I think it has been really great and reflects well on our hospital.
Now, I've seen this little thing going in the background here. Is this a cath that has gone in that you?
Yeah,
you're working in?
this is a heart catheterization. This is the catheter that we use. This patient has been done from the wrist, and we do about 60 to 70% of our cases now from the wrist.
Really? I always thought
Yeah.
they had to go in like
Yeah.
by the thigh or something
We
like
still
that.
have to do some cases from the groin, but we are trying to do more risk cases that are associated with lower risk of complications, less
Really?
hematomas. It's better for the patient.
Okay,
It may be a
okay.
little bit more technically difficult, but I think we have very qualified cardiologists.
Well, with today's
here.
technology that you have here, I mean, it seems like it makes it a lot easier.
It does. It absolutely does. But that's the artery. This is the left coronary artery. And if you look carefully here, you may see a shadow of a stent that is patent. But Cath labs have come a long way from the last 20 years.
Oh, I'm sure. I'm sure with the way they have to, go in with the balloon and everything.
Right.
But what other kind of things can you tell us about?
Now, the Achievement Award with regards to the Blue Distinction does not only involve management of heart attack, but it also involves congestive heart failure, management of all aspects of cardiology, cardiac bypass surgery. So overall, we are giving a very well-balanced service to our patients in Jackson County.
And that's an important thing too. I mean, again, Singing River Health System itself has broadened so much here in the past few years, with what they're bringing in with the systems and everything. It's making it a lot easier for the doctors to work as well.
We are thankful to the system and thankful to the cath lab personnel, all our colleagues in the emergency room. I think the key thing here is just working together to give the best quality of care to the patients of Jackson County.
Now, we can't show you everything that they have here in the cath lab with all the computers and all that and the screens because of HIPAA violations. We don't want to do that. We don't want to get them upset with us. But it's amazing. And I can just have to tell you that. Well, all the different computer screens, the techs, how they look at everything. And again, doctor, the equipment that you actually have it here in working with these people. I guess if they want some more information, they can call or talk to your doctor if you have a family member that you, or yourself are a cardiac risk. I mean, these are great things to know. You live in the Jackson County area, especially Ocean Springs. I mean, your life could depend on it.
We assure you that the quality of care that you will get here is the highest quality of care you can get anywhere in the country with regards to the management of heart attacks and congestive heart failure, etc. So,
Dr. Zayed,
thank you very much.
Always
for
a
coming.
pleasure.
I
Take care.
appreciate it. Thank you.
Again, if you'd like some more information, if you have an issue with your family or whatever, you're going to be in good hands if you come here and remember his great tip. Don't try to drive yourself. Don't try to get a family member to drive you at all. What you need to do is just have emergency personnel bring you here to Ocean Springs.